It feels all right. How to get strong if I can just hold the rod. Means I don't have as much control there. Pretty easy to cast it, but I had to learn how to get the backlashes out and grip the line in different ways.
I thought one of the other boys that tied the tourniquet on his arm or whatever, that Tanner instructed them how to tie the tourniquet on.
This is as bad as it comes in terms of an arm injury.
Tanner was involved in an accident in which he severed most of the soft tissue, blood vessels, some of the nerves, bone in his arm. Our assessment was that 90% of the places he would go, he would walk out without his arm.
So you saw this kid come in with a horrible limb-threatening injury.
They told us it was the worst arm injury they have ever seen.
I think from the plan we had between Dr. Cox and myself, I don't think things could have gone much smoother.
Really on the clock in terms of getting blood flow back, not just to save muscle and bone, but really to save the nerve.
You know, you could just see that things were going the right way and there was hope.
He was in clinic today and the hardware is out and you can barely even tell that that was the affected extremity. It looks great.
I can grip things pretty easily. All my joints bend in my fingers. I feel grateful for the UTHealth team, and I don't think there hasn't been anything I haven't been able to do yet.
I don't like using the word awesome very much, but it does come to mind when I think about the team. Just totally awesome.
My name is Pramod Dash. I'm a professor in the Department of Neurobiology and Anatomy. My research focuses on understanding the pathophysiology of traumatic burn injury. Currently, we are involved with Dr. Cox. We are testing the efficacy of adult stem cells to reduce brain damage in pediatric population. So one thing that attracted me to come to UT Health was the opportunity to work with graduate students. And the beauty about the graduate program here, the uniqueness, is that we don't have any specific programs that will recruit graduate students. Students come in, they can work on any area.
Being trained under a scientist that has so much experience is very important when trained in our graduate careers.
I do clinical and translational research, and this biological science program is helping me do the biological bench work to make the care get to the patients and improve the outcomes of patients.
From a biomedical informatics aspect, being able to work together and to collaborate and to communicate. I'm actually working on a research project where I follow and I shadow along the doctors, nurses, and physicians at a local hospital, and I'm supposed to look at all the interaction that they have, the communication they have with each other, and also with the technology.
Our School of Nursing is really committed to producing the next generation of nurses. We have an innovative undergraduate program that's contributing to bringing out those next nurses. We have the state-of-the-art simulation lab here that has all of the mannequins that can do anything that you can imagine, from birthing babies to having a heart attack and dying.
Being able to know that I can educate and clinically train my nurse practitioners and nurses to do something before they go out there and do it on a human being. That's critical.
After the adrenaline rush kind of settled down a little bit, I was proud of myself. Even though it was a simulation, I know one day that it'll actually manifest in real life, so I can't wait to put my practice into saving someone's life.
It's worth the sacrifice, I think, because if I'm gonna end up in the hospital, I want to know I got a UT grad there taking care of me, because I want them to be doing the right things. That's what we do.
We're sitting in the Center for Healthy Aging. What we're doing is we're harnessing all the strength of the great minds and great educators and great clinicians at UT Health who have an interest in healthy aging and making Houston a better place to grow old.
Being the primary caregiver of somebody with Alzheimer's disease, I have days that are very difficult. It's very traumatic for the family. Dr. Dyer and her staff are there.
Our staff are willing to work very hard for them to give the best possible care.
I am very thankful to UT Health, especially for continuing to be so helpful to me after Milt is no longer a patient who comes into the office regularly.
We've established the Houston Geriatric Education Center under the umbrella of the consortium to have the perspectives of dentists and individuals from the School of Public Health and doctors and nurses and biomedical informatics.
I don't think anyone in our field is more excited than we are here at the School of Biomedical Informatics. The things that we're doing here are cutting edge in terms of how we're going to interact with computers over the next few years.
Aging in place, which means how senior people can be monitored through high-tech technologies at the place where they are familiar with, so that decision makers can provide timely intervention.
And then we can use that information to help manage the care of the patient. People make mistakes, and so the computer can be watching over, make sure these calculations are 100% right every single time.
So we hope everybody's life quality can be improved through this aging in place concept.
Some people think the Texas that we have today represents what the United States is going to look like in the future. And one of the aspects of the population is it's an aging population.
Aging has been diminished in our society, and there are a lot more people living longer, and I should be afforded a very good healthcare system, and I want to participate and be engaged.
It's one of our goals here in the School of Public Health to really keep people healthy. And this really integrates very well with our university Center for Healthy Aging, that we understand the psychosocial, the environmental, and the biologic determinants of healthy aging. My own research here in the Human Genetics Center, where we're all standing, is focusing on the genetics of common chronic diseases. We're interested in identifying genes that are influencing the risk of diabetes, heart disease, stroke, and many of the other afflictions that affect our population at large. We're discovering novel genes, and we use that information to develop new prevention strategies and also to develop new targets for drug discovery. UTHealth School of Public Health is one of the leaders in the analysis of human genetic data. We sequence large numbers of individuals. We get the entire DNA sequence. One of our most important projects today is identifying novel drug targets for Alzheimer's disease.
I love all things dentistry, but I'm really passionate about the elderly and geriatric population. We're at the pre-clinic, and we kind of do a comprehensive care here for our patients. So they come in and we see them from start to finish. We want to continue the research to see the impact that we can do on, our elderly population. It's just not a dental school, it's not a medical school, it's not a nursing school. We're all together in the field of treating people. So I don't just treat the mouth and you don't just treat the body, we treat everything together. And I think that's something that is really changing in the medical field and the healthcare field, and I love being a part of that.
But we can elicit important histories from older patients, give advice to reduce falls and improve their health, help their memory, help them become more functional. If you like seeing that in your older patients and seeing the light in their eyes when you walk in the room, you love geriatric medicine.
I cannot tell you what an amazing sense of pride I have for the UT Health system, because it has given me an opportunity to come in and help save lives.
For me, it was the camaraderie. It just was a family here. Let's all get through this together.
Truly, many of us never leave.
It's a very special place.
We've made so much progress in our capabilities. From here on out, the sky's the limit.
We're not just trying to push people through and get a degree.
This is a job for people that have it in their soul.
It is the finest place to be a healthcare professional in the world.